Hello friends, my name is Dr. Puru Dhawan. In the previous video, we have discussed how we can control the level of creatinine, urea and sodium in a body of a CKD patient. But in this video, we will going to discuss about how we can control the level of potassium, phosphorus and fluid in a CKD body. So let's start with potassium. Potassium is the most dangerous thing, but we fear most of creatinine because if the creatinine level increases, it will give you muscle ache, muscle cramps, itchy skin and weakness. That's it. But if the level of potassium increases in a CKD patient body, it may cause cardiac arrest and sudden death also. That's why it's very important to control the level of potassium in a CKD patient. Now, potassium is present in each and everything, either in low amount or in a high amount. So, in a CKD patient, we have to select those food items that contains potassium in low or moderate amount. So, it will be better for you to take some notes. You have to avoid fruits like avocado, kiwi, dates, dry fruits, banana and coconut because they contain potassium in very high amount. In vegetables, you have to avoid all kind of brown, rooty or you can say tuberous vegetable because they contains potassium in high amount like potatoes, sweet potato, taro, lotus root and the whole list is visible on your skin now. Rest of the vegetables which are grown as a fruit on a plant or a creeper can be taken in any amount like beans, eggplant and okra. Rest of vegetable can be consumed but remember not to make any kind of paste like we do when we prepare some kind of sides, dips or chutneys because concentration of the potassium increases during the paste formation. Few other food items which we have to restrict in a patient of a CKD are jaggery, juices and low sodium. And I will make a separate video why we are avoiding these food items. But in this video, I will give you a tool to judge potassium content in any food item and that is Google. Simply go on the Google search bar and start typing the name of the item you want to check like potato potassium content. If the value comes above 200, that means the potassium content is high and you have to avoid that food item. If the potassium level comes below 200, that item is moderate or low in potassium and that can be consumed in any amount. If the potassium level is 200 above 200 and still you want to consume that food item, then you have to leach it first. And for leaching, you have to remember you have to cut the vegetable in a smaller section. Then you have to soak that vegetable for at least 4 to 5 hours in a cold water. Then you have to rinse it with the fresh water. Then after you can cook whatever you want. I hope you have understood how we can control the level of potassium with the help of diet in a CKD patient. Now let's move to phosphorus. So before moving towards how we can control the level of phosphorus in a CKD patient, it's very important to understand why we are doing this. If the phosphorus increases in a CKD patient, the bones become soft, the bones become more brittle and they causes pain in the patient's body. As phosphorus replaces calcium in the bones. Phosphorus is a soft element and calcium is a hard element. If the calcium is replaced by phosphorus and which is soft, the bones become more softer. The bone become more brittle and causes pain in the patient body. So it is advised to cut down all kind of phosphorus rich food item like milk, curd, cheese, buttermilk, any kind of item which is made of milk contains phosphorus in high amount. If you are experiencing any kind of pain, especially in your long bones, then you have to do two things. First, you have to take vitamin D and calcium supplementation. Secondly, you have to go for phosphorus binder medicines because if we take phosphorus binder medicine, what will happen? It will capture the phosphorus in the food and restrict it from the absorption by the body. This will control the amount of phosphorus in your blood and your bones will be more healthier. Now, controlling fluid is very important in a CKD patient because kidney are failing. When the kidney are failing, the fluid controlling mechanism in the patient is also disturbed. And if the patient take less amount of fluid, what will happen? The lesser water will be available for the body to flush creatinine, urea. And if the flushing is low, the level of creatinine and urea increases in the body. If the patient take large amount of water, what will happen? The fluid accumulation will happen. The pedal edema will appear, pleural effusion, breathing issues, fluid overloading, and all the problem will come. Now, you have to understand, fluid requirement varies person to person based on climate and occupation. Person living in Texas needs more water in comparison to the person living in Alaska. Teacher needs more water in comparison to person doing desk job silently. It also depends upon the skin type. Few precipitate more in comparison to others. That's why one amount that fits all CKD patient doesn't exist. Now the question arises, then how a CKD patient should control the amount of fluid with so much variables? The answer is listen to your body's sensor. If your lips are dry, throat is dry, then your body is deficient of fluid. Take small amount of water like 1 cup or 100 ml of water and repeat that 1 cup of water after 10 to 15 minutes depending upon your thirst. You also have to look for the sign of fluid overloading. Now the question arises how a common person can check the sign and symptom of fluid overloading. You have to press the area near your ankle. If the depression is there, that means the fluid overloading is also there. Then you have to cut down the amount of water and salt intake. Just remember, you have to make a fine balance between dehydration and overhydration. Do not cut the water amount completely. It will degrade your kidney faster as there will be less water to flush creatinine and urea. Kidney has to work extra. And if you take extra fluid to flush creatinine and urea, this will cause more serious problems like pleural effusion and pedal edema. Just take sufficient amount of water that is asked by the body to perform bodily function normally. Now I hope you have understood how we can control the level of potassium, phosphorus and fluid in a CKD patient. Before leaving, see what our patient has to say about our treatment.
My name is Francis Onyango. I am in Nairobi, Kenya. I suffered kidney disease sometime last year. This was diagnosed around March 2022. It was indeed a stage 4 of kidney infection. And when I asked the doctor of what happens to me next, and she recommended that I was only one stage to dialysis, which was so scaring to me, something I did not even expect. But there it was. I was with that condition. The doctors tried to manage it, but to no avail. Yes, I could use the medicine, which was just like painkillers, but it was not improving my kidneys. I was scared, I was worried, until a friend visited me, and he advised me that there are a group of doctors who are under SRIAAS Institute of Herbal Medicine. And when I searched the internet, I came across Dr. Puru Dhawan. Dr. Dhawan was so kind and he was so helpful. After I had sent my details, he recommended for me the herbal supplements that they have in their institute. I was put on a 2-month dose of the herbal medicine together with a diet plan, which was vegetarian in nature. After 2 months of treatment, my kidney condition improved. And when I went for the lab test, to my surprise, my urea improved from 48 to 24. My creatinine level also improved from 3.6 to 1.07. My GFR, which was at 29, increased to 40. This was amazing. To my surprise, this medicine worked and they have no side effects at all. I have used it for 2 months. My kidneys have improved. I can be able to work. I can be able to walk long distances and even run. This herbal medicine works. Thanks to Dr. Puru Dhawan and your group of doctors at SRIAAS. I would recommend to somebody out there who could be having a similar problem like mine. Please get in touch. Get in contact with this Dr. Puru Dhawan and his group of doctors.